Other acute viral hepatitis. Hepatitis E. This is caused by hepatitis E virus, HEV, an RNA virus transmitted by the fecal-oral route. It accounts for sporadic and major epidemics of viral hepatitis, particularly in developing countries, but also in other parts of the world, e.g. 50% of non-A non-B, NA&B, hepatitis in Hong Kong. It is rare in the UK, with only about 2% of adults being immune. There is low viral fecal excretion and hence low secondary spread. Hepatitis E is seen in young adults and resembles hepatitis A. The incubation period is 34 to 46 days. Jaundice is often of sudden onset and liver biochemistry is cholestatic. Acute liver failure is rare. It is diagnosed by IgG and IgM antibodies to recombinant HEV proteins. Alternatively, HEV RNA can be detected by polymerase chain reaction, PCR. The disease is self-limiting. Acute hemorrhagic syndrome with encephalopathy and renal failure is a complication seen most typically in women in the last trimester of pregnancy and is associated with a 20% mortality. Community-acquired hepatitis E infection does sporadically occur in the UK and should be considered as a cause of seronegative hepatitis. There is a suggestion that there may be an animal reservoir as the virus has been identified in a number of animal species including swine, sheep, cattle, poultry, and rodents. Cytomegalovirus. Cytomegalovirus, CMV, can cause an acute hepatitis, most commonly in those who are immunosuppressed. Patients may be asymptomatic, with hepatitis recognized solely from elevation of serum transaminases, but symptoms can range from fever and malaise to a devastating illness with jaundice and other features of CMV infection including pharyngitis, esophagitis, gastroenteritis, pneumonitis, retinitis, and bone marrow suppression. Diagnosis is by demonstrating CMV on tissue biopsy, detection of CMV by PCR in blood or urine, or by finding IgM to CMV. Treatment is with intravenous ganciclovir. Epstein-Barr virus. Primary infection in children is asymptomatic. In young adults it can mimic viral hepatitis with fever and right upper quadrant pain together with elevated bilirubin, in 50%, and transaminases, up to 20 times normal. Diagnosis is made by a positive monospot or raised IgM to Epstein-Barr virus capsid antigens. The disease is self-limiting. Other rare causes of viral hepatitis include herpes simplex, adenovirus and rubella in the immunosuppressed. Parvovirus also rarely causes hepatitis in association with pancytopenia. Note that hepatitis C is not a cause of acute liver disease, but is the commonest cause of chronic hepatitis in the world.